segment is brought to you by Seafood Nutrition Partnership, Oklahoma City.
Well, the Seafood Nutrition Partnership's mission of heart health and fighting Oklahoma's heart disease issue, all supported by great groups and organizations. Dr. Arvita Ed, she is with the Internal Medicine and Pediatrics at Norman Regional. She joins us to talk more about heart health. Good morning, doctor.
Thank you so much for having me.
I have to say, you know, with seafood, it's one of those simple things. Obviously, number one, it adds a little bit of variety, but we're going to concentrate mainly on omega-3s. And, you know, with your experience with, diagnosing and treating heart disease, what have you seen as far as omega-3s helping out those that might have heart conditions or maybe those that want to prevent any kind of problems?
So omega-3s are part of an overall package deal of a heart-healthy diet.
Okay.
That also includes eating things like low-fat dairy. It also includes eating lean meats like fish, chicken, also turkey. Fish is very important because it's high in omega-3s. Omega-3s decrease your cholesterol and also decreases your LDL, or what we call your lousy cholesterol, or your bad cholesterol. That's another way so you can remember it, right? So just eating 2 additional servings of omega-3 rich fish like salmon, mackerel, tuna, decreases your risk of developing heart disease.
And is this something that obviously it would take, a period of time, or is it something where, you just incorporate it now, you can actually see a difference and that sort of thing?
Right, so what we normally do is we say at least eat 2 servings per week, right? And then you can increase your servings. Each serving has 250 milligrams of omega-3. And then while you're increasing your added of omega-3s, then at the same time you are decreasing your fats, saturated fats, things like your red meats, right? So that also helps to decrease your cholesterol as well.
Once we get that going, let's say we brought it down, let's say we're at a very healthy level. I mean, will we feel different? Because I imagine our heart flows better and that sort of thing?
Yes, absolutely. Because what happens is your cholesterol decreases, you have more energy, you're less lethargic, you're less sluggish, that type of thing. But overall, you decrease your risk for developing heart disease. And that's the most important thing that you need to know about.
All right, you there at Norman Regional, you obviously see a lot of this day by day. This is what you do. This is you study, research, as I had mentioned here as well. How are we doing here in Oklahoma?
Well, we can always do better.
Sure.
And nationwide we can always do better. The problem is people are unaware of the risk factors for developing heart disease. I tell my patients to know your numbers, but also to treat your risk factors, meaning you should know that your blood pressure should be less than 120 over 80, right? How many times you go to the doctor and they say your blood pressure's fine? Well, what does that mean, right?
No, it's so funny because just yesterday I did that.
What does fine mean, right? Same thing with cholesterol. Your cholesterol should be less than 200. How many times you get the results and they say, oh, everything's normal? Well, if your cholesterol is 199, is that really normal?
Okay, that's a good point.
Exactly.
And by the way, to find out what the omega-3s in our blood pressure, we do simple blood tests outside of the blood pressure?
So what you do is you go to your primary care physician. We're the gatekeepers. We're the people that keep you healthy. We are in the trenches and we're fighting for you. So just making one appointment on a yearly visit, getting your cholesterol taken, getting your blood pressure checked, making sure your glucose isn't elevated as well.
And get that seafood in the diet is important as well.
Getting the seafood in the diet.
We have to talk about, do you see many survivors of heart disease?
Absolutely,
really?
Absolutely.
Good.
We do see a lot of survivors of heart disease, and by that time you're usually put on a statin. But again, we tell our patients to increase their omega-3s because that also decreases your cholesterol as well as your LDL or your bad cholesterol.
And Dr. Ed, you have a personal connection with this as well.
Yes, I do. Yes, I do. The picture that we're showing right now is actually my dad.
So we have a picture of your father here, and tell us his story.
So my dad smoked for 40 years. And his big thing was, I'm a smoker and I'm not even on blood pressure medicine. And eventually all of that catches up to you. One day he had shortness of breath, he went to the hospital, they kept him and he had heart surgery within 2 days.
Wow.
Right, so he had a come to Jesus moment, he lost 50 pounds, he's no longer a smoker, and now he's doing well, bowls 3 days a week.
And we can take that as, what you were mentioning earlier, as what is normal. He thought he was fine.
He thought he was absolutely
and
fine.
we have to keep on day to day. Great way for you to be able to help yourself is getting those omega-3s, is getting more seafood in the diet. And if you want more information on Norman Regional, you can check out Norman Heart. They are on Twitter at Norman Regional, and of course on Facebook, just look for Norman Regional Health System. And for more information on the Seafood Nutrition Partnership, Katie and my friends down there, 201 North Broadway, Suite 100 and more. You can check them out on the web at seafoodnutrition.org and make the pledge now. On Facebook, look for SNP-OKC. On Twitter, Seafood for Health. And of course, we'll have all these links on our website, okcfox.com.